Hello, I'm Reverend Dr. Kimron D. Caesar. I'm Chief Research Officer at Steep Hill, and I want to welcome you to Greenflower Media's exclusive, Clearing the Confusion. We'll be talking about how to choose and use cannabis in a responsible manner. My position at Steep Hill as Chief Research Officer is I dictate a lot of the research that we do, the different areas that we look for things, and then the instrument scientists get on it and figure it out. My expertise are, I've been an herbalist for 50 years, I've been a chemist, physician assistant, an ordained minister for 40 years, and I practice as a pharmacognosist. Pharmacognosy is a pharmacist that works with plant extracted medicine. Today, what I would like to do is address patients, primary caregivers, and others who want to get a better handle on the primary understanding of cannabis as a medicine and how it works. There's a lot of myth out there, including with scientists and clinicians, and this is something that we need to resolve. By the end of this lecture, you should be able to have a more intuitive and intellectual sense of what you need to know for making decisions involving yourself as a patient or as a primary caregiver. If you are a regulator or somebody like that, you should have a better idea of what is necessary on a general basis for medicine. Okay, let's get started. I want to start by giving an example of a myth before I go into any details. And the way I'm going to do this is I'm going to show you a slide. And this is a slide that most people who know cannabis recognize. And what you see in the slide is you see a very tall sativa, you see a little short, squat indica, and you see this little ruderalis on the side. Now, when these plants grow in nature, they all have certain chemotypes where they have all the same chemicals but in different ratios, and it creates different effects in the body. And before man started hybridizing them, sativas were used for one thing, indicas were used for another thing. We now have over 4,000 hybrids that we've created, and we've messed up the chemistry in these plants badly. As a result, if you're looking to use the word sativa and the word indica to mean something medical, it's inappropriate at this point since the chemotypes of these plants are no longer clear. If, on the other hand, you simply want to talk about the physical morphology, is it a tall, lanky plant that lives in very humid, hot environments, or is it a short, squat plant that lives in dry, arid, hot environments, right? And in that case, physical morphology, this works fine. The biggest problem is everybody talks about cannabis and sativa as if you're using these for medicine, but they don't know about the chemical content. Today we're going to discuss that. That brings me to my next slide. Look at this. We have medicine bottles here. There's no information on them. We don't know what's in them. We don't know if any label that's on there is valid. So we don't know what we're getting. And we certainly don't know the origin of the medicine, how it was produced, and whether it was clean enough to even be used for small children. Okay? So what we're going to do today is we're going to take that bottle, and little by little, we're going to fill in that bottle with information. And that's what I want to do. Now, let me start this at the beginning. About 500 million years ago, we climbed out of the ocean, and we had this homeostatic system. And this picture shows you a homeostatic system that every living organism has. It's very complicated. And if you look closely, you notice that everything from the left upper corner to the lower right corner, every bit of that is interconnected. And the way it's interconnected is it's all communicating with itself through a lot of different types of receptors, including the endocannabinoid system, opiate receptors, serotonin receptors, steroid receptors, and pathways like the COX-2 pathway. All those are in here regulating everything that happens. Okay? So it also turns out that most drugs fit into more than one type of receptor or pathway, which is why a lot of times when we give credit to the endocannabinoid system, that's not true at all. That's not where the medical effect occurred. Maybe it occurred in the COX-2 pathway like steroids, powerful immune effect. Maybe it occurred in an opiate receptor. Turns out that some of the couch-locked terpenoids play in opiate receptors. A lot of people don't know that. Okay? That answers some questions. So this is our homeostatic system. When everything's working properly, this system works at a very high level of function, which is something we've evolved with. If you take drugs that work with your homeostatic system, they work gently within it to stimulate it to work correctly and do the things it normally does. We have a lot of modern synthetic drugs out there that are sledgehammer effect. They don't go in and work with homeostasis. They hijack that entire system and force it to do things. Normally when we see this, especially with things like the most modern horrible opiates like fentanyl, okay, we see it not only hijacking homeostasis, but creating all sorts of horrible side effects that we just don't see with natural occurring opiates, as an example. So, working within the homeostatic system is very, very important not to create other issues when you're ill as much as possible. Having said that, let's take a look at what's going on here for a moment. Okay, so when we look at a lot of these plants, they have different amounts of drugs in them and different kinds of drugs. And those drugs are in different drug families. In this case, I'm talking about terpenoid-rich plants that are high in terpenes of different types, including cannabinoids, which are terpenoids. If you're used to the Mediterranean diet, all that sage, that rosemary, the thyme, chamomile, lavender, all those are terpenoid-rich plants, powerfully medicinal that we've been using forever. Turns out that all those chemicals in those plants are also in the cannabis plant because terpenoid-rich plants share all those chemicals. The only difference is in what ratios do they come in, and that tells you what the plant is good for. Now, an interesting thing about this graph you see is that when you have a cannabis plant, that plant, as far as we know to date, we have analyzed it. We know there's close to 150 different cannabinoid terpenoids in it. So there's about 150 different cannabinoids out there. Psychoactivity, very rare medical property in terpenoids. Out of those 150 so cannabinoids that we know exist, maybe 4 have some degree of psychoactivity. That's very different than the common alkaloid drugs that you're used to seeing in pharmacy that have powerful amounts of hallucinogenic effects, whether that comes from psilocybin, whether that comes from an opiate. These are all alkaloids. Even large amounts of caffeine under wrong conditions in the TRPV2 receptor can cause problems like this. Okay? So what do we see here? We see a plant, basically. And in that plant, we have what we call the raw chemicals, or the cannabinoids that naturally grow in the plant and form in the plant. These are cannabinoid acids. They're part of the terpenoid acid family of drugs that are powerful immune modulators. These things, any autoimmune disease, you can use them for treating poison oak. You can use them for treating chronic pain from arthritis or from traumatic brain injury. Within these raw part of the plant where we see the cannabinoid acids, you have your regeneration compounds that turn on stem cells to grow new cells in the body. These are probably the single most important cannabinoids in the entire plant. Anybody aged 35 or over that has been in sports injuries, anybody suffering age 35 and over with arthroarthritis, these sort of things, rheumatoid arthritis, it's good for that. Again, all the autoimmune diseases. I have psoriasis on my arms, and I keep it controlled just by taking an oral dose of THCA, and it makes it stay at a very minimal stage because it's an autoimmune disease. The next group, the heated group, is what happens when we heat these cannabinoid acids and we decarboxylate them. And we remove a carbon dioxide molecule, kind of like gas escaping from soda, okay, and we open it up. And now we have these neutral cannabinoids. These are the ones you've heard about the most. The most famous one you've heard about is delta-9 THC, which does have psychoactivity and is amazing at killing pain, especially acute pain, and amazing at working with tremors. Tremor disorders of all kinds are affected by this. At very high doses, we use delta-9 THC to treat cancer because it kills cancer cells. Also noted in the heated category, we see CBD. Powerful for using as an anxiolytic for people who have anxiety issues. Also really important for seizures, which are different than tremors in terms of how they work in the body and how they perform. And we're finding CBD is just absolutely important for all these children with all these epileptic conditions. You also have a third group, and this is when you apply even more heat, but for a large amount of time. And what you end up getting are these long-term heated aged products. And in there we see things like CBN, which is another cannabinoid which delta-9 THC converts to over time. It is powerfully sedative. It's about 5 to 6 times as sedative as any of the cannabinoids. So for a sleep agent, when your mind's having trouble shutting down, that's a very important drug. What are some of the good things about cannabinoids? Well, here's the wonderful part, folks. I told you about all those pathways and receptors. They cannot physically fit into the pathways or receptors that stop you from breathing, like opiates do, or stop your heart. They can't do that. So this massive, severe side effect that we're all afraid of does not occur with most terpenoids because they don't fit in those receptors. The cannabinoid acids, because they have the CO2 functional group on them, they cannot fit in the CB1 receptor correctly. So they can't get you high, which means these are wonderful treatments for the elderly and things, right, that don't want to get high. Matter of fact, what they're doing, again, is they're fitting in the COX-2 pathway where normally steroids go. The fact that they're not a steroid means that you have none of the negative side effects that you get from steroids. You don't get steroid psychosis, better known as roid rage. You don't suppress the formation of your natural endogenous steroid, cortisol, in your body. Right? When you take a steroid, that cortisol disappears down to nothing because your body stops producing it. Okay? And then you have to slowly wean off those steroids and hope that the cortisol jacks up the way it normally does. It does not recognize cannabinoid acids as a steroid. It doesn't stop production at all. It works with your system. That's pretty darn powerful. Okay? I'd like to point out also in the heated category, we have a couple new cannabinoids, not new, but we're researching heavily, both CBG and CBC. These are the very first drugs anywhere in medical history that will start the growth of new brain cells in a dead and decaying brain. Okay? We see examples where we give this to people who are age 64 to age 84, who have senility, and we see the dead parts of the brain that have dried and concreted out, and we see brand new brain cells forming in there. Now understand that up until 2004, we all knew that the only way to get a stem cells, you had to surgically harvest it for somewhere, pull it in, and then surgically reimplant that where you wanted to go. And we never could find any stem cells that do brain cells. Neurons, yes. Nerve cells, yes. Bone cells, yes. Other cells, yes. Not brain cells. This is pretty remarkable. More to that, we also see another one down there in the heated category, THCV, tetrahydrocannabivarin. Turns out that this stimulates bone stem cells. So it grows bone cell. This is going to be very important in female medicine where we deal with osteoporosis. And once we master how to use this for osteoporosis in females, we will finally be ready to go to places like Mars, where microgravity means that after 1 year of travel time, you physically cannot be in microgravity ever again, right? So if it takes 15 months to go to Mars, and after 12 months your bones are too brittle, we've got a problem. We can't land on Mars. So by dealing with this with female medicine, by mastering the problems of osteoporosis, we're going to be able to go to Mars because of this drug and female medicine study of it. I find that remarkable, and I find that really important. Okay. You can see I'm passionate about this. It's because these are pretty safe medicines to use, okay? They don't cause the problems that I see in my patients otherwise from other drugs I use. Let's look at a lab report for a moment. Okay, so here we have an example of a lab report. This happened to be a research sample here at Steep Hill, and so it doesn't give a strain name. And what you see is this particular one, if you look at the cannabinoid portion of the report, is very high in THCA. So again, raw, out of the plant, extracted cold, where you have almost all THCA, you have one of the single most important cannabinoids. Again, like I said, the most important one that I use for treating all sorts of ailments. Anything from cancer to arthritis to psoriasis. And by the way, THCA we also know is also good for certain psychological conditions. People taking THCA tend to sleep better at night because it tends to reduce some of the anxiety. That probably has something to do with the fact that it works in the HT steroid receptors, or plays with them, okay? Next to this, you see a terpene report, and those are the terpenes that are in there. Remember how I said that cannabinoids are terpenes? They're one small subfamily of 150 out of 50,000 total in different families. Well, there's all these different families of terpenes, okay? And they all do different amazing things. One of the most amazing in female medicine has always been the linalool family, linalool acetate, these compounds that come out of French lavender. There aren't a lot of drugs out there that are specific muscle relaxants to the uterine muscle. That's pretty amazing, okay, that it does that. Also, just like chocolate, it has the ability to release the happy endorphins so that you feel better when you're moody. So in a way, lavender and chocolate, great combination for those kind of situations, okay? So that's just what one terpene does. Now here's the interesting thing. Cannabis, if it gets you high psychoactively, has all sorts of different personalities of high, whether it's clear-headed, project-oriented, whether it's chaotic, whether it's psychedelic, whether it's social. And it turns out that the reason it does that is because delta-9 THC psychoactivity is a puppet, a marionette being controlled by a puppet master. And that puppet master are all those other terpenes that change the way it works in our brain and changes the way it works in our body. This is partly due to the entourage effect that we talk about in this drug, where in much smaller concentration you have other terpenes that make things work better. Whether that's loading them from the blood into the brain, whether that's loading it from the skin into the bloodstream, whether that's loading it from the small intestine into the bloodstream. All these things. By the way, a good example of that is CBD only fits in the CB2 receptor, but it does it very, very poorly, where it doesn't function hardly at all. The moment you add caryophyllines, which are a type of terpene family, to it, it goes up 30-fold. I mean, it's pretty remarkable how the amount of CBD gets absorbed in that receptor much more efficiently in the presence of caryophyllines. And caryophyllines are interesting, right? We see these in black pepper. We see these in a wide variety of different things. If you happen to be into Chinese herbalism, you see it ylang ylang as a plant, for instance, in flowers. Turns out that one of the amazing things with these terpenes, and again, I'll just give caryophyllene as an example, you have beta caryophyllene and you have alpha caryophyllene. They're like mirror images of each other, right? They look the same, but they're not, right? Like mirror images. Here's the one difference. Alpha caryophyllene, better known as humulene, is sedative, and beta caryophyllene is not. So for instance, when I make up CBD medication, oral medication, I have the equivalent of Dayquil and NyQuil, depending on whether I'm using beta caryophyllene in their daytime use or alpha caryophyllene in their nighttime use to also help them get a good sleep. So all these sort of amazing things with those terpenes are possible to improve this medicine. I also want to point out that a lot of times it's not the cannabinoid in there that's actually helping you out. It's one of these other terpenes that are 10 times, 20 times more effective at it. Okay? So that's remarkably important with all those terpenes. And again, because we evolved with this for 500 million years, most of the nasty side effects like you see in synthetic modern drugs are not there. Because about 500 million years ago, when we were chomping on these plants, if they didn't agree with some of us, we didn't survive, and that didn't get passed on the gene pool. That's why most of these problems are pretty much resolved with these terpenes in our body. So part of what I tried to explain to you here today was that there's a lot more to this than the endocannabinoid system. There's a lot more to this than just a couple of cannabinoids. There's a lot. There's a lot more to it than the psychoactivity. We learned, for instance, that certain things are silly, like the whole business with sativa and indica. I'm not now going to tell you how that works and why as an example, which I waited till now to do. So everybody says use an indica at bedtime, you have trouble sleeping. The problem is that indicas, if you look at what they're designed as, they're designed to keep you clear-headed so you can play video games all day long, but keep your muscles, your skeletal muscles relaxed on the couch so that you don't get restless while playing on the couch. How does that help you sleep unless you have restless leg syndrome or something where your body is in spasm? If your muscles are in spasm, an indica is great, but other than that, it will not help you sleep. That's misinformation. Then they say, well, what do you mean? It's got to be a sativa? They're energetic. Yes, they are energetic. But let's look at the way this energy works. This is an adrenaline energy effect. You smoke a sativa, and because of the particular terpenes in there, it causes it to get energetic. What that means is it dilates your blood vessels. That causes a drop in blood pressure. Homeostasis is, wait a minute, I have a loss of blood flow, a decrease in blood flow, I got to fix that. So it uses adrenaline to jack up your pulse rate, which now goes from 70 to 100, right? And now you're more energetic on an adrenaline energy. Now, what's the one downside to an adrenaline energy? 90 minutes later, when it drops down, you're tired, you want to take a nap. Yes, that's what you're looking for. So the trick to taking a sativa is, yes, it's energetic, but you take it 90 minutes before bedtime, so just about the time you've gone up and that drop has come down, you're ready to tuck yourself in bed because your brain wants to go to sleep. Now, if that happens to be a sativa that had humulene in it, alpha caryophyllene, that drowsy one, good for you. If it happened to have a little CBN, another sedative, good for you. But we're using sativas, not indicas. And yet everywhere you hear on the web, it's indica, indica, indica. And we now know that you can't even use the word sativa and indica to talk about what medicine is in the plant because we've goofed up the genetics of the plant, right? So again, we're back to a lab test on that. So that's how that particular myth got started, kind of, the misunderstanding. That's what you need to know. So back to this, summary. We told you things that were right about this. We told you things that were wrong. We admitted that even scientists and clinicians are getting this wrong, which is why we're in the business of teaching them, which is one of the things I do, for example, in my training. Here's the most important thing if you want to be successful as a patient or you're going to be successful as a primary caregiver to a patient. You have got to always be your own best advocate. Okay? What does that mean? That means you have to learn about your disease. It means you have to learn about the treatments. In this case, when you go to a dispensary and you say, I need medicine, and they say, how much THC do you want? You tell them, no, 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 I want to see the lab reports. Show me the lab facts. They tell you, okay, here's that THC report. You go, no, we're not talking about medicine yet. I want to know, I want to see the safety reports. Does it have mold? Does it have pesticides? Because I have to first determine if it qualifies to be used to even make medicine for me to give to my child or my grandmother. Okay? So when you go in there, you ask for the lab facts. They tell you a THC number, the answer is no bet. Show me the safety data. They don't have it. Tell them you're not a real dispensary and you really don't care about the patient. And you turn around, you walk out, and you do what you need to do, which is find a dispensary that cares about lab testing, starting with all that safety testing that's got to be done before we even consider using this medicine. Okay? This is what I need you to do. And the more of you do that, the more pressure you're going to put on all the cannabis industry to change. Now, I'm going to tell you a story that goes with that because I want to drive this home. I'm very aggressive about this for a reason. I'm one of those people who indirectly has lost 3 patients who have died from fungus infection in the lungs that came from Aspergillus mold that was found in cannabis. Those patients were being treated for cancer. They had impaired immune system. All 3 of those female patients were being treated for cancer, but they died of Aspergillus mold in the lungs, which is in a documented peer-reviewed paper from UC Davis Medical School that we worked on with them to document that. We lost those patients because the cannabis was dirty and it killed. Cannabis activists, they don't want to talk about this, right? They want to say nothing but good stuff. But the truth of the matter is that when we're seeing mold in 1/3 of all the cannabis we test, and we're seeing pesticides at 75%, and a certain small percentage of that is killing people, and we're not even tracking it to CDC, because this is a Schedule 1, we don't know how many people died from cannabis. But they do. And I personally know of ones, and it's very upsetting when this happens to patients. So, you have to be your own best advocate. You got to demand testing. You got to demand safety testing. And you need to put pressure on these people when they don't care about it, but they claim they do. Last thing I'm going to say to you is, and I've already lectured on all this, you've seen it right here. We need good lab standards. We always need to ask for lab reports, and you have to be your own best advocate. You just do. The other thing I will tell you is I am utterly dedicated to my patients. That's what I've done for 50+ years. If you have anything you've heard here that you might be confused about or have questions, please contact me. My information's there. It's very important that we do everything we can with patients. And you've taken the first step in advocacy by being here today and taking this course, right? I already know that this is important to you. So if you want to ask questions, please feel free to do so. And you know, I would check in at Green Flower Media a lot because they're developing a lot more material, and all of us are getting better at producing this material. And so hopefully within about the next 1.5 years, we will finally have all the appropriate education we need for patients and caregivers and regulators alike. So I hope you continue checking in with us on that if you would. Thank you very much for your time. Now is a part of this that I'm really excited about. It's the question and answer period, and this allows us to drill down and get more information to round out your educational experience today. So I'm going to read some questions that have been prepared, and we'll see what we can do. The first area of questions deals with terpenes. The question is, what are the cannabis terpenes and how do they impact your cannabis experience? Well, So I think I mentioned this, but let me go in a little more detail. Turns out that worldwide about 12,000 plants produce about 50,000 different terpenes. They produce them in terpene families. There's the cannabinoid terpenoid family. There's the linalool family. There's the caryophyllene family. The limonene family, citrus cleaner, right? There's the osamine family. All these different families that all contain somewhere between a dozen and 3 dozen different members closely related with similar drug and medical properties, okay? And so those are in all plants. Turns out the cannabis plant, every single strain, probably has close to 5 dozen to 10 dozen different terpenes in it, along with the cannabinoids, okay? And different strains coming out of different genetics will have more of one family of these terpenes and less of other families of these terpenes. For instance, one of the things that we look at when we look at a classic muscle relaxant, what they used to call an indica in this case, or a couch lock, is they have a large number of terpeneols in them. Terpeneols are terpenes that cause muscle relaxation when they go into the opiate receptor into the body, and also they calm the stomach, by the way, if they happen to be in the stomach. This is why limonene and the entire limonene family, including the terpeneols, are good for gastric reflux. By the way, if you have gastric reflux, smoking a joint a couple times probably is going to be slower to get rid of that effect than taking half a milliliter or 500 milligrams of limonene, which is completely harmless. It has GRAS status, the highest level of GRAS status ever awarded by the USDA and FDA. Okay? So we have these different terpenes in there. And like I said, different strains have different types. And so they'll be better for treating this disease or worse for treating that disease, depending. One thing to remember about this too, by the way, is although there'll be strains that'll be better at treating certain diseases than others, there's no one strain that is the ideal treatment for any disease. That's another myth that everybody has. I can take any strain that is the best it can be for treating that disease. I can then reformulate it by adding other terpenes to that it needs, that it lacks to be better at it. And then when I treat that patient, I get a much better effect. That's what we call targeted terpenoid therapy. Okay? So, whole plant is not the best for treating any given disease, any given patient. A targeted formulation is best for that, to make sure you have all the right drugs and all the right ratios to do it. But barring that, we have what I call the 85-85 rule, something that most herbalists are aware of, and that is if you have a particular strain that's good for a stomach ache, or a particular strain that's good for anxiety, and it works for 85% of the people, giving them 85% relief, then that's a good general purpose herbal or pharmacognosal or pharmaceutical for that particular treatment. An example would be aspirin. Anybody, if I take 100 people and I give them all 650 milligrams of aspirin, 85 of them will say that they got good results, and 85% of those will say they got 85% relief. So that's a good generalized treatment. Is that the best treatment for a specific pain in a specific patient? Probably not. There's probably a very targeted treatment that would be best for that. What's important to understand about terpenes? Well, first off, you need to know what the ill side effects from terpenes are, right? Always start with any drug asking yourself, what's wrong with it? What can it do? Okay, so for terpenes and terpenoids in general, they have certain negative side effects like all drugs do that are, and in this case, common to this family. Probably one of the first ones is rashes on the skin, dermatitis. There's 2 types. There's just simply phytoplant dermatitis, phytodermatitis, and then there's photophytodermatitis. That's where you put you have your lemonade stand and you're outside under the bright sun with all the ultraviolet light, and the rind where the limonene is rubbing on your skin, and you get a rash. Okay? So you'll find that there are a lot of allergies reported in the EU, in the European community, right? And most of those allergies that they're reporting for terpenoids are specifically skin rashes. That's the most common problem that we have with them. One problem we don't have is overt psychoactivity. Although there are a few terpenes that have overt strong psychoactivity, like delta-9, THC, there are not that many. Probably less than 1/10 of 1% of all the terpenoids out there. Terpenoids vaporize well. Okay? They turn to gases well, so they're easily to inhale. I want to point out that although your lungs provide access to receptors, the vast majority of receptors for terpenoids are in the nose. We have a tremendous number of different receptors, which is why when you smell linalool, or you smell chamomile, or even rosemary, you get these different effects. So, people using a vapor pen that has cannabis or other terpenoids, you want to exhale that back out through your nose, and you will definitely notice a more improved effect, and you'll notice different qualities that you weren't getting from inhaling because you weren't getting enough concentration over those receptors in the sinus. So it's not just the lower respiratory tract that we're working with to get these drugs in, it's the upper respiratory tract and the sinuses. Notice that a lot of times one of the common things with terpenoids is the single most common medical effect, they're antibiological. 65% of all the terpenoids we've tested, and we've tested nearly 10,000 of them, are antibiological in 2 or more ways. They kill bacteria, they kill fungus, they kill viruses, they kill protozoans like amoebic dysentery, right? Or malarial parasite, another protozoan, right? They also kill abnormal cells in the body as part of homeostasis. So they kill not only cancer cells, but they remove and prevent excessive scar tissue and connective tissue. So they're anti-fibrotic, right? Because they don't allow excessive amounts of scar tissue to form. Okay? So there are a lot of terpenoids that you find especially used in wound dressing materials because they're very profound at dealing with what we call vulneraries in herbalism, which are things that are really good at skin protection. They were probably stimulating dermal skin cells all along, and until 2004 we just didn't know that was possible, so we weren't looking. Now we're looking, now we're discovering. Okay? So that's something else that terpenoids do. What are some of the most popular cannabis strains? Well, there's one that I find is very important for female medicine. That's Blue Dream. And the reason is it has an unusually high level of linalool similar to French lavender. We know, which I've already mentioned, that linalool and linalool acetate, especially those two in combination, small amount of linalool acetate as an entourage effect, linalool help it load up proper. And what you get is you get a reduction in cramping of uterine muscle tissue, and you also get a release of a happy endorphin, probably through the serotonin receptor. Okay? So that's a very important one for that. Here's an interesting one. It turns out that all of these energetic sativas that are clear-headed, project-oriented, right? Jack Herrera, Super Silver Haze, these are powerful at a couple things in particular. Because they create a minor form of OCD, they're project-oriented, you can give it to somebody who has ADHD, and then they'll start doing one project at a time and completing and going on the next. People who smoke Silver Haze, they're planning on running a marathon, writing a book, painting their house, and getting it all done in one day, okay? Some of the other interesting ones that you might want to take a look at is the more social chaotic highs from things like sour diesel and AK-47. It's interesting that they actually have a social quality. I mean, there are a lot of drugs when people are doing them, they don't share them with anybody else. But on these highly social drugs like Delta-9 THC, people want to share with more people around them. And so, for instance, what we see is an increase in communication with these folks. Strains that are high in caryophyllene and limonene tend to create what we call light bright effects. They cause flashes of inventiveness and creativity. A lot of writers like using strains like those when writing or creating or painting. Again, we have strains that have couch lock chemicals in it. Probably my favorite old-fashioned indica is Granddaddy Purple. It fits the 85-85 rule. It has nearly 1% alpha terpineol in it if it's grown properly. It also has an increased amount of linalool and myrcene in it, which helps. And so as a muscle relaxant and basically a body relaxant, Granddaddy Purple is an absolutely wonderful old-fashioned indica that still has reliable chemistry in it. We have new strains coming up, and admittedly a lot of those are recreational. It's flavor of the month with different flavors. I think this is kind of funny because me personally, I actually find that all those different flavors are more pronounced from these different essential oils. I mean, I find, for instance, in my compounding, if I have depression issues, I'm adding citrus essential oil, combining that with my cannabis essential oil to fight depression issues, because of what we call the light bright. So you have the limonene family of compounds in there that are in sweet orange, are in key lime, in Meyer lemon rind, right? And so I find those very interesting to blend with it. And you can do that with other things. By the way, cannabinoids are not always the best terpenoid. For a lot of anxiety, inhaling German chamomile to get this bisabolol is much more calming, and it doesn't make you at all drowsy or confused. And so it's kind of like CBD. And actually, I find that I do a lot of blending of bisabolol or German chamomile with these other strains that are high in CBD, because I'm using them for anti-anxiety effects, as an example. Are terpenes in all cannabis products? Yes, they have to be. And the reason is that these are building blocks. These terpenes are building blocks in all plants, starting with little 5-carbon building blocks, and they turn into 10s, 15s, 20s. They're used to build all sorts of things in the plant, including hormones. The blood of the plant is what we call polyterpenoid. It's basically the blood of the plant is made out of terpenes and long-chain polymers. And that's the blood of the plant, the sap, the latex. Pretty interesting, right? So terpenes are used everywhere. It takes no less than about 12 different terpenes in steps to slowly build up to build a cannabinoid. Turns out that sesquiterpenes are related to purple chlorophyll, and they're part of the synthesis in creating that. So these terpenoids have been used for the plant forever to do all sorts of amazing things. Do you have any other thoughts in guiding consumers about terpenes? Yes, a lot of people are starting to get innovative the way us trained professionals are on how to blend these things. So my recommendation to you is you have to remember that, like in the rest of the food and drug industry, any cannabis products you use, any terpenoid essential oils, any of the other herbals you use, they all have to be food and drug grade quality. Understand the difference. Long time ago, in the 1970s, we figured out that the smaller a nasty impurity in a drug gets, as you remove more and more, it gets harder and harder to remove what's left, and you get to a point where you simply can't remove it. Therefore, if it's a small amount that's deadly and you can't remove it, the only solution to the rules for food and drug science is you can't have the impurity in there when you start. Therefore, any and all drugs, chemicals, reagents used in the processing of food and drugs don't have these in them to begin with. So food and drug grade terpenes are very common. You can look on the web to get them. By the way, because these are also used as flavoring agents. Remember I said about the whole Mediterranean diet? These are used as flavoring agents, about 1,500 of them worldwide. So you'll see that some of these actually come with things like kosher certificates. I know that there's beta-myrcene available out there that comes with a kosher certificate. Okay? So when you go to these companies, you need to make sure they have food and drug grade. Okay? The other thing to know is that no supplements. Foods are well regulated. Drugs are well regulated. The one area that is not regulated is the area right in the middle, which is all the supplements and all that sort of thing, and nutraceutics. Only the Europeans have regulated them. Nobody in the Western Hemisphere, nobody in Asia, nobody in Africa. That's why the EU are the only ones that have already established allergens over 25 years ago in these foods. So, if you want to know who the experts are that know what the truth is and how to handle food and drugs, in the case of supplemental, you have to go to European regulation to understand that, because they're the only ones who've done the hard labor. So one of the problems is you start with a plant, and let's just take the cannabis plant as an example here. You start with a plant that, if it's properly grown, you have about 20% cannabinoid content, and you have between another 5 and 10% other terpenoid content. Now, during the process of cleaning up, extracting it, some of these things that boil off easy, because they vaporize easy, they boil off, they get lost. And so generally, as processing goes on, what you see is a situation where you see the terpene content, especially the monoterpenes, the smallest molecular ones that evaporate the fastest, okay? You see them leaving quicker than the others. On the other hand, these big chunky miroditerpenes, like cannabinoids, they don't evaporate out. They're there for a very long period of time because they're very slow and sluggish because it's a big molecule. So we do see that. Then when you get to the extraction process, you lose even more, because when you're boiling out your butane or you're boiling out your CO2 or this sort of stuff, when those gases leave, a lot of these things also leave with them because they're gases. As a result, we quite often see situations where these things are stripped of the terpenes, we don't have enough in there, and they don't function proper. Let me give you a really basic example that doesn't involve any extraction where this occurs. There's something that a lot of you know and you've heard of called creeper weed. And the situation here is you have this weed that in the laboratory we know for a fact it tests at 20%, so we know it has a lot of THCA in it, right? But when we smoke it, it takes 5 to 10 minutes to feel anything. And then it doesn't feel like 20%, it only feels like 10 or 12%. It's not loading in the brain very well. And the reason is there's a partition between the blood and the brain cell. It's a blood-brain partition that keeps drugs from flowing in there and blowing it up and exploding it, right? It regulates through homeostasis. And what beta-myrcene, for instance, does is it lowers that partition a bit. It eases it down so both the myrcene and other terpenoids and other drugs can flow across there well. That's an example of entourage effect. So what you see in the creeper weed is, if you look at the myrcene content, it's horribly low, around 0.1% or even 0.04%. We've seen it, right? Doesn't get you very high, very quickly. Now, if I were to give you some myrcene, I could do that several ways. I could have you eat half of a mango and wait 45 minutes for it to go from your gut into your bloodstream, into your brain, and get ready. Or I could have you vaporize some myrcene, maybe in the form of hops essential oil. And now that myrcene's in your blood, I give you that same creeper weed. It doesn't take 5 or 10 minutes. The very first hit, you feel the high, and you feel much higher, right? So you have those kind of effects that go with that as well. Now, that means there are a lot of vape pens that don't work so well. We have people doing water soluble now, right? The problem is terpenoids are not water soluble, and it's not truly water soluble. They're cramming into a chelating agent that holds it in there, okay? A liposomal or nanoparticle sort of situation. The problem is that they weren't designed to do that, and they don't come back out easily. I know that because in the lab here, we try to analyze it, and we may only be able to get out between 40 and 60% of the cannabinoid that's stuck in there. We can't get it all out. Remember, this is in a laboratory and tested. We're using a sledgehammer effect, right? If we can't beat it out of there in the laboratory, the human body can't do it. And by the way, the FDA is going to look at that, and they're going to be very upset and said, yeah, I hope you had a pharmacist that screwed that up and that you weren't just flying from your hip. And if your pharmacist did screw that up, he's now in trouble because it's not the way we do this. So, issues like that. So you do have situations where you're low on terpene. And sometimes it's not the cannabinoids that's doing the big thing for you, as I mentioned earlier. Sometimes it's those terpenes that are more important. So again, look at the lab report, making sure that you know everything that's in there is important education. By the way, if you start checking terpene lab reports, pretty soon you're going to realize there are times when you don't even want cannabis. There's something else you want that has that terpene in higher concentration, you know? So that's a problem. And again, for me, I don't worry about the loss of terpenes because every formulation I make, I'm figuring out exactly in product-wise what I want in there and adding it to having the right balance, right? I'd like to explain something about healers. There are a lot of tragedies in our lives of dealing with patients, and that's because life and death are always on the line. And especially with the very young, that tends to get to us real easy. So, you know, every day when we go to work and we do our job, you know, we're dedicated to fixing these illnesses that these people have. The last thing in the world we want is to have stupid stuff happen that makes it worse, okay, things that should have been avoidable. And so I'm about to talk about one of those, and this is something that I tend to take very personally because I've lost a fair number of patients this, and you're reading about thousands of patients that dying from this every day. So we're going to talk about opiates and the problem with opiates right now, and there's a bunch of things I want to cover with you, okay? To begin with, way back when we extracted out opium poppy, those opiates that were in there were kind of common in terms of the sense that they were similar to other drugs that we've been eating our whole lives. And so these particular alkaloidal drugs, it's an alkaloid-rich plant, and all those different opiate alkaloids that are in there were things that we kind of evolved with easily. And the reason is that the plant evolved with those. That meant the plant had to play by the same rules that all other plants do that are evolving drugs, which meant that the opiates that formed in a limited way with a limited number of types of functional groups that naturally nature put on there, okay? Those drugs have side effects. One of the problems with opiates is they're addictive, right? They have other problems. They're powerful at shutting down muscles and pain, so eventually they stop you from breathing, right? Because they stop your muscles from working. They just make them go to sleep, right? These are problems with opiates. What's really sad about that, of course, is that, the United Kingdom, went after China and created that whole opium war business by addicting an entire nation, which ended up blowing up in their faces when the Boxer Rebellion happened and that all got resolved. It's ironic that we're now in another situation. And past 1950, we have the synthesis of many new synthetic drugs. And they work better than the old plant drugs. They work faster, they work harder, it takes a smaller amount. They do ridiculous things that all these plant medicines didn't do. They come with a tremendous number of side effects that are much worse. We see this. If we spend 500 million years eating food and there's never 3 fluoride atoms stuck to that molecule, and suddenly we have this synthetic drug that they're sticking 3 fluoride atoms on that, and the human body's never seen that, no animal body's ever seen that. Tremendous side effects, right? That's the situation with modern opiates, for example, where we have these new structures that do things. So we have everything from heroin and codeine, which has phosphate group added, morphine, these sort of things. And now we're jacking up, and those all had a range of about, 10 milligrams of codeine would be equivalent, or 60 milligrams of codeine was about equivalent to 4 milligrams of morphine. We have these equivalences figured out. Now we have the modern synthetic opiates. And these numbers are not a 10-to-1 ratio for how potent. No, these numbers are 100-to-1. They're 1,000-to-1, 5,000-to-1. So, it's 5,000 times more potent than opiates are supposed to be that naturally form. No wonder they cause problems. No wonder they're so addictive. No wonder they put us down. Okay? No wonder we stop breathing. We had a horrible situation recently where we had a police officer, apparently, that was hypersensitive to fentanyl. And they had just checked in a bunch of evidence from busting somebody, and there was a small amount of white powder on his shirt. You probably read about this in the news. And a fellow cop said, "What's that white powder?" He just went like this, knocked it off. It was on his skin. He was dead shortly thereafter because he had an anaphylactic shock to it. He was allergic to this fentanyl. Okay, horrible. Okay? Now, here's what you need to know. We can get people off of opiates. There's a process to do it. It's called opiate harm reduction. And it turns out it works something like this. If you understand, you can go to your doctor or you can look on the web and you look at the opiate equivalent table. What that is the table I mentioned earlier that says 60 milligrams of codeine is equal to so many milligrams of heroin, equal to so many milligrams of morphine, equal to so much fentanyl, right? That allows you to get the same pain relief with these different dosages of different drugs as a conversion table. Here's what I want to tell you. We now know what the equivalent value is for delta-9 THC. We know that 10 milligrams of delta-9 THC is equivalent to 60 milligrams of codeine, right? Now, that 60 milligrams of codeine has a certain percentage chance of stopping your breathing, right? Remember what I said about those terpenoids can't stop you from breathing? So instead of giving that patient 60 milligrams of codeine, we give them 30 milligrams of codeine, and we give them 5 milligrams of delta-9 THC to go with it. We get the same pain relief. The difference is the chance of them stopping breathing, we're just cut in half. 50% harm reduction, just that quickly. Now understand this, in medicine, we chip away at harm reduction. We'll get 7% here, we'll get another 3% here, we'll get another 11%, and maybe we end up with 37% or 35%. Here's a chance to immediately, across the board, miraculously get a 50% harm reduction immediately with that patient. That means the chance of overdosing from the things dropped by 50% across the nation immediately. More importantly, we can start ratcheting them down on these drugs and switching them over to other analgesics, including delta-9 CBD. And if they have a lot of chronic pain, of course, we switch them over to THCA or those similar drugs. So we can slowly get them out of this opiate addicted phase that they're into from doing it. Turns out, if you look at the prices of opiates, the amount of money they make on it is just horrendous. If you look at the amount of money that would be required to do, say, a harm reduction using cannabinoids, it's actually highly cost effective. Well, not for big pharma, but it is for the rest of us, including our insurance companies, the hospitals, the patient, everybody. So harm reduction is an important thing. We can do it easy, okay? And we're starting to learn how to do it. And again, let's say that you have X amount of morphine that's going to cause a 50 or a 10% chance of stopping breathing, and you add that to a sedative that has a 10%, you're up to 20% chance, right? The fact that you can take that 10% and cut that in half to 5% by cutting the dose in half and giving half a dose of Delta 9 is pretty amazing, right? It's just amazing, right? Now, the other beautiful thing about this happens to be that we know that there's a lot of stomach cramps that go with opiates, for instance. That's a big problem with opiates. There's a lot of stomach cramp issues. Turns out that Delta 9 is pretty kind about helping that. So it actually helps with some of the symptomology when you give it too. There's a type of weird inflammation that occurs in the bowel. It also includes dumbing down of certain receptors by opiates that cause constipation. We find that by adding cannabinoids to that, you can reduce some of that. I think it's pathetic that they had to come up with a new opiate that causes diarrhea so that it counters the constipation from the other opiates. Basically, you know, think about it, right? You're hearing these commercials on TV. We now have this for opiate constipation. It's another opiate you can get addicted to. Why are we going there? How does that help my patients? It doesn't. Okay, it doesn't help my patients. And I refuse to have little kids go on that when we have other options. Okay? And if you're talking about somebody elderly in life, age 75 or older, especially if they have some kind of dementia, they're already trying to deal with quality of life at that point. You want to go and make them horribly confused on these drugs when they're down to the last few months or years that they have left? You want to take away that quality of life from them with these drugs? That's just a horrible thing to do. We don't do that to people. So, we have a new process for opiates. We're going to go after it. And we're going to go after it really soundly. Another area that we're going to go after is all the steroid use, because I think I mentioned earlier that we have cannabinoid acids that make it so you don't need those. Okay? A thing I want to point out, by the way, is that opiates are for acute pain. So if I stuck you with a knife, I burnt you at that instant, you have acute pain. It's really good at switching down those receptors and dumbing them down. For chronic pain, where you have inflammation tightening around nerves for years on end, the opiates dumb it down. They don't make it go away. Okay? That's where steroids and anti-inflammatories come in. That's where cannabinoid acids come in. So opiates for chronic arthritis, chronic pain from sports or whatever, is not even the proper treatment, because they're not the thing that reduces the inflammation, therefore making the pain go away at the source. Okay? I want you to think about that, and again, if you have any questions for me, please feel free to write me and ask. Thank you very much.